Thank you. And for our final public comment before we go to break, we'll turn to Christine Wagner. Please proceed.
My name is Christine Wagner, and I'm the founder of the Cure GM1 Foundation. GM1 gangliosidosis is a neurodegenerative lysosomal storage disease that primarily impacts babies and children. My daughter, Iris, suffers from juvenile GM1. She was diagnosed at age 5, and she is now 16. For 11 years, we've done everything in our power to help the drug development process, raising millions of dollars, publishing papers, participating in natural history studies, conducting a caregiver preferences study, and organizing the first externally led patient-focused drug development meeting for GM1. With respect to scientific, regulatory, and policy issues, I'd like to highlight 3 key topics that are relevant to GM1 and other similar conditions. First, accelerated approval based on primary disease biomarkers. Second, the ethics of placebo-controlled trials in neurodegenerative diseases. And finally, much needed flexibility for highly heterogeneous populations and ultra-rare diseases. GM1 was distinguished as a unique condition in 1968. It has an incidence of 1 in 100,000 to 200,000. The deficiency of beta-gal and accumulation of GM1 ganglioside is the very definition of the disease. We must ask ourselves, why treatments which have corrected GM1 ganglioside to normal levels are still out of reach of dying patients? Has a framework designed for common diseases caused the abandonment of our programs? In recent years, 4 companies have gone bankrupt and shelved their programs, despite several of the trials demonstrating excellent results in biomarkers, and even stabilizing patients and improving quality of life. Accelerated approval based on primary disease biomarkers could save programs that are now on the precipice of being lost forever. Children and babies impacted by GM1 are experiencing brain damage, some with degeneration beginning in the womb. Our disease is so severe and so intense that nearly no family is willing to risk receiving a placebo. The youngest and healthiest children are being asked to give up their fleeting, minuscule period of normalcy and to forego possible treatments that have a reasonable likelihood to benefit them. Finally, our disease is a spectrum. It's extremely heterogeneous and ultra-rare. GM1 requires regulatory flexibility with respect to labeling of products. There's a real possibility that overly strict labeling could prevent swaths of our community from ever having a treatment. Innovation and flexibility are desperately needed for ultra-rare neurodegenerative diseases like GM1. Let's create a more compassionate framework and meaningful change. Thank you.